Welcome to this brief training on insulin monitoring and documentation in an adult residential program. Residents who have diabetes may require blood glucose monitoring, insulin administration, meal planning, or assistance following their individualized diabetes care plan. Safe care requires more than checking a glucose number and documenting that insulin was given. Staff must consider the whole picture, including what the resident has eaten or is about to eat. Always follow the resident's current physician or authorized prescriber orders, medication administration record, individualized care plan, and your program's policies. Staff should only perform tasks they are trained and authorized to perform. Before checking blood glucose or assisting with insulin, verify the resident's identity and review the current orders. Confirm when the glucose check is required and whether it is related to a meal. Pay attention to the resident's condition. Are they alert and behaving normally? Are they sweating, shaky, confused, unusually sleepy, weak, or complaining that they do not feel well? Never rely only on the glucose number when the resident is showing concerning symptoms. Follow the resident's care plan and your program's procedures for abnormal readings or symptoms. Diet is an important part of diabetes management. Before meal-related insulin is administered, staff should know whether the resident is actually going to eat and follow any instructions in the resident's individualized orders concerning meals and insulin. Ask practical questions. Has the resident eaten? Is the meal ready? Did the resident eat less or more than usual? Did the resident refuse the meal? Has the resident been vomiting or unable to eat? A resident's food intake can affect blood glucose and may be especially important when insulin is involved. Never independently change an insulin dose or substitute your own judgment for the resident's prescribed plan. If the resident is not eating as expected, has an abnormal glucose reading, or the situation does not match the instructions you have been given, follow the prescribed parameters and contact the appropriate licensed healthcare professional when required. Perform blood glucose monitoring according to the resident's orders and your program's approved procedure. Use appropriate infection control practices and the resident's designated equipment. After obtaining the reading, compare it with the parameters in the resident's current orders or diabetes care plan. Do not guess what should be done when a reading is outside the prescribed range. Follow the resident-specific instructions for low or high blood glucose, including directions for treatment, notification, rechecking, or emergency care. Insulin is a medication that requires careful attention. Before administration or assistance, follow your program's medication procedures and verify the resident, insulin, prescribed dose, route, and scheduled time as applicable to your setting. Pay particular attention to meal-related instructions. Never give additional insulin because you think the glucose is too high. And never reduce or skip prescribed insulin based only on your own judgment. Follow the authorized order and obtain clinical guidance when the order or the resident's condition requires it. If something does not look right, stop and clarify before proceeding. Staff should know the resident-specific instructions for responding to abnormal blood glucose and recognize possible signs of hypoglycemia or hyperglycemia. Possible low blood sugar symptoms can include sweating, shaking, hunger, weakness, confusion, unusual behavior, or decreased responsiveness. High blood glucose may be associated with symptoms such as increased thirst, frequent urination, fatigue, or other changes. Symptoms can vary. Follow the resident's individualized plan and seek emergency assistance when the resident's condition meets emergency criteria or when directed by your program's procedures. Remember, diabetes care in an adult residential program is not simply about recording a blood glucose number. Think about the resident's blood glucose, prescribed insulin, diet and actual food intake, symptoms, and individualized care plan together. Check carefully. Consider whether the resident is eating as expected. Follow the authorized orders. Document what actually occurred. And when the resident's condition or circumstances do not match the plan, follow your program's escalation procedures and obtain appropriate clinical guidance. Monitor. Consider the meal. Follow the order. Document. Communicate. This training provides general staff education and does not replace resident-specific medical orders, medication administration requirements, professional licensing requirements, or your facility's policies and procedures.